All right, we're live.
Bismillah.
Bismillah. Assalamu alaikum, everybody. We're going to start off our program in a few seconds. We're just going to give a couple of seconds for people to continue to log in. And you know what? I think we should just start. Is everybody okay to start?
Yeah, I think it's 2 minutes left for 6 o'clock.
Okay.
Just wait for 2 minutes.
That's fine.
On time, yeah.
We're going to give it one more minute and then we're going to start our program. We're just giving people a few seconds to log into the session right now. Okay, I think we should start. It's 6 o'clock and everyone is pressed for time these days. With that being said, assalamu alaikum to everyone joining us today. Before we start, I'd like to ask everybody to please make sure they're on mute. If you have any questions related to today's program, please hold off on asking until the end. We will schedule a question and answer session. We do have a question and answer session scheduled. Contact information for our speaker will also be provided after the call. If anybody would like to contact our speaker one-on-one, they are more than welcome to. Our program today is going to be scheduled for 90 minutes. One thing that I need to clarify is that this program is live. It is on Zoom as well as YouTube. So if you do have a question, please try not to provide any personal financial information or personal background information. This platform, it's susceptible to be stolen. So whatever information you need directly from our speaker, you can always contact the speaker directly, as I stated. With that being said, on behalf of IEC Husseini, today's program is a basic breakdown of health insurance options available to the general public, be they through the Medicaid program, which is a state-sponsored program, or the marketplace, which is also known as Obamacare. The current health environment and the current insurance industry is very complicated. However, there are many resources available to everybody. With the recent resurgence of COVID across the world, the need for health insurance is very important right now. If your specific needs are not addressed in today's program, as I stated earlier, our speaker is more than willing to help you one-on-one. Our guest speaker today is Syed Qamar Mehdi. Qamar Uncle has over 10 years of experience in tax preparation, business tax services, retirement planning, health insurance, Medicare insurance, life insurance policy, and financial expense insurance, which is also known as a small whole life insurance policy. Over his career, he has found that most individuals do not have the proper knowledge regarding what options are available to them, specifically related to health insurance. The government has many options available to people where individuals can qualify for low cost or free health insurance depending upon their needs. On behalf of IEC Husseini, I would like to say thank you to Khamar Uncle for donating his time today. At this time, I request that Khamar Uncle please take the lead and start the program when you're ready. Everybody please recite a very loud salawat. Allahumma salli ala Muhammad wa ali Muhammad.
Assalamu alaikum, everybody. So I am here to start showing the basic of health insurance is available to the general public. There is most people familiar with the Obamacare. It will be start when the President Obama is first time allow people to get the health insurance, and he set up the marketplace. The marketplace is a place where all the insurance companies they put their plan and everybody can get the coverage through marketplace, and it is the private insurance company is participating. Government is not participating. Government is just establishing, making the benefit, and the PTC is called premium tax credit, and the reduction of is called CSR. CSR is they will reduce the co-payment and the deductible, what is the regular plan for the low income people. When Mr. Obama signed the Affordable Care Act, our country entered a new era of healthcare. As the law of the land, health reform is changing how people get healthcare, how they get health insurance, what is cost, and who pay for it. As a result, people are asking what's changing and what's staying the same. Should I get a different plan or keep what I got it? If I need a plan, or do I get one? Health reform and you. Health insurance is a valuable benefit for employees, especially because many employers help pay a part of its cost. If you already have a health insurance plan through work, in most cases, it is still your best choice, even with health reform in place. So this is a good news for people with insurance through their employer. Not all that much is changing for you, but if you want to learn more about what changing and coverage choice under health reform, know before you need health insurance, then this 10 minutes guide can help. It explains the main changes and allow how people in different situations can make health reform. Number one, understand the basic. How does health reform work and how might it affect? Discover the fact behind the buzz. Everybody talking about health reform. What are the fact behind and buzz? Learn about different, see how 9 different people make health reform work for them. Which is the most like some of you know. Under the basis, the Affordable Care Act, the law commonly known as health reform, passes in 2010 and aims to make health care available to all Americans. It's a complex law, but there is a summary of how health reform works. Everyone with few exceptions is required to health insurance. Health insurance is based on the idea of sharing costs across a large group of insured pupils. People who chose not to buy health insurance must pay a penalty. Now, from 2019, it is changed. Now there is no penalty. But before 19 up to 2018, there is a penalty for that. But now it's no penalty if you don't have it. Most health insurance plans include new benefits like preventive care with no cost sharing and cost for pre-existing condition. Where to get a health insurance plan? Large companies, 50 or more employees, typically offer health insurance plan to employees. Many also help pay for these plans for people who work in large companies. Getting insurance through their employer is often the easiest way to get a plan and like the best option. A small business, fewer than 50 employees, can also provide health insurance to their employees, and some do this already. People who work in a small business may be able to get health insurance through their employer. Employer may work with the insurer either through the shop marketplace or the outside the marketplace like they do today. Employer can purchase insurance directly or through a broker or with the help of a navigator in shop health marketplace. Health insurance marketplace or exchange are a new way for people to shop for any and buy a plan. Marketplace are meant to help people find a plan that meets the standards set by the federal government. While every state marketplace will offer plans for from insurance companies, the marketplace themselves are set up and run either by the state, the federal government, or both together. Each state marketplace will be divided between individual for families and individual and shop health plans for small employers. Marketplace. Insurance company can sell plans through employer or directly to people, just as they have done in the past. Under the health reform, they can also sell approved plan through the marketplace. Getting healthcare provider are encouraged to provide efficient quality care. Hospital doctors and other providers may get paid more when they provide care that improve patient health and less when they don't uh, to improve the delivery of the healthcare and improve patient health. Providers are finding way to become more efficient by adding technology, streaming process, and coordinatory care more efficiently. Role of a government. Federal and state government run the marketplace. They also support specially trained pupils called navigator. Navigator provide helps information to people and a small business looking for health insurance. Taxes and penalties paid by employer help offset the cost of health reform insurance companies. But now there is no penalty for that. Under the basis improving access to healthcare, you can choose your doctor from among any primary care provider or pediatrician who in your plan network and accepting new patient. You don't need approval in advance for emergency care and emergency room visit count as in network care. However, this applies only to real medical emergencies. People who use the emergency room when they don't need to may have to pay higher cost. You don't need a referral for OB gynecology services. You can make an appointment directly with an obstetrical gynecological doctor. Most health insurance plans will cover certain preventive care services with no cost sharing, including blood pressure and cholesterol screening, recommended immunization, and mammogram. Expanding health plan benefits. Health insurance marketplace, also called exchange, are a new way for people to buy health insurance. There are two types of marketplace, the individual marketplace and the small business marketplace. The individual marketplace are where individual and families can shop for a plan. The small business marketplace are where a small business can pick a plan or a range of plans from which his employee can choose. The plan offered in the marketplace must meet government requirement for coverage, quality, and value. If you are a new employee, the waiting period for health plan coverage to start can't be longer than 90 days. You can't be denied coverage due to a condition like diabetes or heart disease. You can't be charged a higher premium because of your condition. This is the biggest. Before Obamacare, the insurance company have a choice, so they can deny your coverage on pre-existing condition. This is the biggest thing Obamacare give to the people. Most health insurance includes coverage for essential health benefits such as doctor, visit hospital care, and prescription. This applies to both individual and small employer plans. Kid can stay longer on a parent's plan until the age 26. Lowering healthcare costs. Generally, your yearly insurance deductible is limited to 2,000 for individual, 4,000 for families. This applies to individual and small employer plans. Generally, at least 80 to 85% of insurance premium dollar must be used to pay for healthcare and activities to improve healthcare quality. It means they bonded the insurance company, they have to spend at least 80 to 85%. If they spend less, the money will be returned to the insurance, to the people who insured. There are no lifetime or annual item limits on essential health benefits. Your plan must keep paying for coverage expenses that are considered essential. Yearly out-of-pocket costs for member of high deductible plans are limited to 6,350 for an individual and 12,700 for a family in 2014. This includes co-payment, deductible, and co-insurance costs after that. The plan pay all covered expenses. Every year they increase that one, okay. Employer who have had a plan in place for several years may not have to make some of the changes required under the Affordable Care Act. This is called a grandfather plan. If you have a plan that was created on or before March 23rd, 2010, check with your employer to learn more about health insurance. Discover the buzz and behind. The health reform law is designed to help more people get health insurance, control healthcare costs, and improve how people get health care. The law is called the Affordable Care Act, but the most people just call it health reform. Whether you call it, these changes are creating a lot of buzz. Here are some things you might have heard and the fact behind that. The individual mandate, the buzz, everybody has to buy health insurance. The penalty will start out small, go up each year, but now there is no penalty. Mr. Trump changed the law in 2019. If you have a health insurance through your employer, you don't have to pay the penalty. The penalty is not related to anything. If your employer offer a plan that meet government standard and your employer pay part of the cost for your plan, most likely that's the best choice for you. But for many other people, health reform will make health insurance more affordable. The government is creating a standard for what are considered to be essential health benefit. And affordable plans providing new way to get such plan through marketplace and even helping to pay for it in some cases. This can work in several ways. Those who can't get a health insurance plan through their employer can buy a plan in the new state marketplace. Plan is marketplace are offered by health insurance companies and meet the requirement. Health insurance companies that meet the new government standard and tax credit are available for small businesses that qualify. Those with a moderate or low income less than 45,960 for individual may also be eligible for financial assistance from the government to help pay for their plan. If purchased through individual marketplace, government subsidize pay for a portion of the cost you pay each month for a plan. The premium subsidies can be taken as a credit against annual federal taxes or as credit against the monthly plan premium. People with low income can also get subsidized to help with out-of-pocket costs like co-payment or co-insurance. Number three, the market health insurance marketplace. The government is setting up marketplace to sell health plans. The fact the government is not going to sell health insurance, but it is setting up new health insurance marketplace, also called exchange or marketplace. In each state where health insurance companies can sell their plan, there are also special marketplace where small businesses can buy plan for their employees. Some marketplace will be run by a state, some by the federal government, and some by the both working together. If your employer offer health insurance and contribute to the cost of coverage, that is likely to be your best choice. But people who aren't eligible for an employer sponsored plan or have an employer plan that is not considered affordable for them under the government standard. The individual and shop marketplace will offer a choice of plan providing different amount of coverage at different price. Marketplace will also help buyer compare and understand the plan benefits. Some of the plans sold in the marketplace probably come from insurance companies whose name you know. There are different level of plans to choose from bronze, silver, gold, and platinum. These plans generally provide coverage similar to plan being offered to individual or offered through an employer today. The marketplace have a set time period when you can compare and select a plan, called an open enrollment period. For most state, initial open enrollment period October 1st and will run until March 31st, 2014 for coverage effective January 2000. After any open enrollment period and you will not be able to buy plan through. But right now, the open enrollment period is from November 1st to December 15, 2020 for this year. The marketplace, unless you have a qualified life event until the next annual open enrollment. If you are miss the open enrollment period, you can buy only if there is some life-changing events. You can get a subsidy to help you buy a plan on your state marketplace. The federal government determines your eligibility for a subsidy. However, the Kaiser Family Foundation offer a calculator that may give you a general idea of what the government may determine to be your eligible subsidy. This is like a website you can go and also calculate yourself. People can shop and apply for a plan through the marketplace three-way: online, by mail, or in person with trained helper called navigator. You can also get the help of insurance broker, agent in all three methods of shopping. Expanded coverage. Under health reform, health insurance plan will provide better coverage than before, depending on what the government consider to be essential health benefit in your state. The fact is true that some health plan will offer more coverage than before. You meet new standards set by the health reform plan must include certain preventive care services with no cost sharing. This includes coverage for individuals such as health screening and immunization and special preventive care for women, including prenatal office visit, breastfeeding, supplies, and mammogram, which may not have been included before. Plans sold through the marketplace have to be qualified plan offering 10 kind of benefits called essential health benefits. These include doctor visit, hospital care, prescription drugs, lab tests, maternity care, and more. Plans sold outside the marketplace may also have these benefits. Pre-existing condition. Health insurance companies must provide people with coverage even if they had health problem in the past. The fact is true. Under health reform, you can get health insurance even if you already have health condition, often called pre-existing condition. This is also true for the dependent covered under your plan, and you won't be charged more because of any pre-existing condition. The amount you pay each month is the same for people with and without pre-existing condition. While while health reform help people with serious health condition get insurance, it's important to provide care that help people maintain their health and keep any condition under control. This approach can avoid more healthcare costs in the longer run. Health reform focus on preventive care may also help people avoid developing some serious health condition. A new reason to quit. If you smoke or use tobacco, there's bad news. Your health insurance can now charge you up to 50% more. There never been a better time to quit. But right now, they are not charging you extra. But if you want to quit, that's the best time. Okay, these are the scenario example for these 9 people want to make health reform work for them. Mr. My employer offer health insurance, but I want to know my other options. My employer is offering the health insurance. How can I get coverage for the rest of my family? I like the plan I have through my employer. Is my plan going to change? I work part time and I am not eligible for my employer health plan insurance plan. I can't afford my employer health insurance. How can I get a plan I can afford? I am new to this whole thing. I don't have any health insurance. Where do I start? I am going to be too old for my parents' health insurance reform, health insurance soon. How can I get a plan I can afford? I am going to be 65 soon. What are my Medicare options? I have a health condition that keep me from getting health insurance. Can I get it now? Okay, here is how I have insurance. My employer offer health insurance. I want to know. Health insurance, health reform does offer a new way to get health insurance. Your state marketplace, if your employer plan meet government standard and is affordable, there is affordability requirement for that, it is likely you won't qualify for government financial assistance. Meaning individual marketplace probably won't help you save money on a plan. My employer is offering my health insurance. How can I get coverage for the rest of my family? If your employer does not offer coverage for a spouse or children, your spouse and children can buy coverage separately directly from an insurance company or agent or in the individual marketplace. Health reform does provide potential government financial help for people to pay toward the premium for a plan purchase in the individual marketplace. Subsidies are based on household income and family size. So you will want to complete an application for the individual marketplace to determine whether or not you and your family qualify for financial help. I like the plan I have through my employer. Is my plan going to change? An approach for Jordan. In most cases, the best choice is to continue getting coverage through your employer. Many employers pay part of the cost of the plan, and this can be a big help to you. Under health reform, you can expect your old plan to offer new protection. For example, your plan can't limit the amount it will pay per year or over your lifetime for essential health insurance, and you can't be denied coverage. To help control rising health costs, many people are choosing high deductible plans. These plans require you to pay a deductible amount of several $1,000s for non-preventive care services. Before the plan starts to pay for your health care, to help you pay for the health expenses until you meet the deductible. Many employers are adding health saving account or HSA, which let you pay for the health insurance period is condition. For many people, that like getting a discount on their healthcare expenses. I work part-time and I am not eligible for my employer health insurance plan. If your employer don't offer your health coverage, doesn't meet the new government standard, you can buy a plan in your state individual marketplace. You can also buy insurance from a health insurance company directly or through an insurance agent outside of the marketplace. So, yeah. If your employer doesn't offer, you can go buy a standard. You can buy a plan in your state individual marketplace. You can also buy insurance plan from a health insurance company directly or through an insurance agent outside of the marketplace. I can't afford my health insurance. How can I get it? An approach. Health reform includes some incentive for employer to offer affordable plans to their employees. First, check with your employer to see if they are offering new, more affordable plans. If so, this plan is like for you. If your employer doesn't offer a plan that is affordable, use an online subsidy calculator to see if you get help plan. Market, but only the market will determine if you will be eligible for government financial assistance. You have a low income, you may be able to get a government subsidy to buy a plan in the individual marketplace. I am new to this whole thing. An approach to the candy. If you work at a small company, health reform is making it easier for your employer to offer a plan that meets the government standard. Talk with the person in your company, a company who handles this thing. If you are not working or your employer doesn't offer an affordable way, you may be able to get a subsidy to help you buy a plan through the marketplace in your state. If you are like Jim, I am going to be old and any my parent health insurance plan soon. If you are going to old for your parent plan soon, and you will need to get your own plan and approach for it. First, make sure you are too old. Under health reform, you can stay on your parent plan until age 26, even if you have graduated from college. If you are getting close to age 26 and you don't have a job that offer health insurance, you can buy a plan through the individual marketplace in your state. I am going to be 65 soon. What are my Medicare options? An approach to the pet. As you retire, you will probably transition to Medicare coverage. To pay basic healthcare costs just as you would have done before health reform, you will be enrolled in Medicare Part A automatically, but Part Part B, but you must enroll in Part B during the open enrollment period, which starts 3 months before you are 65 and last for 7 months. Consider adding several coverage to help with the cost Medicare doesn't pay. For example, Medicare supplement is called also Medigap plan and Medicare Advantage plan or your employer retiring health insurance plan. If your plan doesn't cover drugs, you may also want Part D prescription drugs. If you are working past age 65, the rules are different. If your company has 20 employees or more, you can generally stay on your employer plan, but be sure to enroll in Part B within 8 months after you retire, or you may have to pay a penalty if you work for a company with fewer than 20 employees. Your employer's plan will provide only supplemental coverage after you're eligible for Medicare. So it's important to enroll in Part B as you near age 65. I am a health condition that keep me from getting insurance. If you don't have health insurance because you couldn't get coverage or were charged extra because of the health condition, there is a good news. Health reform means you can get the same plan as someone else without a health condition. Your application can't be denied because of their condition, and you can't be charged more because if it is. The following how to can help you put these things. Find out if you can get help by insurance. If you can health insurance from your employer, that often the best. You may be eligible to government financial assistance, so you can buy a plan in state marketplace. Your income is less than 45,960 as an individual and 94,200 for a family of 4. Your employer plan failed to meet the minimum value standard. This means it pay on average less than 60% of the overall cost of the providing essential benefit or plan. If the plan fail to below level of 60%, its value is below the lower level of plan called bronze plan offered in state marketplace. The person in your company who handle benefit can also be meet the bronze plan. Your employer plan failed to meet the government affordability standard. It failed if the government pay your employer plan for employees only coverage is more than 9.5% of your yearly household income. So there is for the government thing, there is other thing here. Here a simple definition for some of the complex terms. Benefits. The healthcare item for services covered under the health insurance plan, covered benefit and services not covered at defined coverage. There is a co-insurance. Co-insurance is generally in the percentage, and the co-payment is fixed amount. You have to go to the doctor, you have to pay fixed amount. You go to the hospital, there is a co-insurance, you have to pay the percentage. The cost sharing, the share of cost covered by your health insurance plan that you pay out of your own pocket. This term generally include deductible, co-insurance, and co-payment or similar charges, but it doesn't include premium balance billing amount for any other providers. There is a deductible. The amount you owe for healthcare services, your health insurance plan cover before your health insurance begin to pay. For example, if your deductible is 1,000 per year, your plan won't pay anything until you meet the 1,000 deductible for covered health services subject to the deductible of that year. Insurance coverage for family members of the policy such as spouse, children, or partners. Essential health benefit that individual and a small group health plan must offer under Affordable Care Act. Grandfather plans. An individual health insurance policy that is exempt from any changes required under the same. So if you have a health grandfather plan through employer, so it will not affect you. Health insurance is a new, transparent, and competitive insurance marketplace where individual and small businesses can buy qualify health insurance plan. Marketplace offer you can choice a plan that meets certain benefit and standard. This is offered by through companies and most people. I'm just skipping this one, the health saving account and things. A basic financial measurement used in the Affordable Care Act to encourage health plan to provide value to enrollee. If an insurer use 80 cents out of every premium dollar to pay its customer medical claims and activities that improve the quality of care, the company has a medical loss ratio of 80%. If a company medical loss ratio is too low, it must refund some premium dollar to the member. Is called rebate. The most you pay during a policy period usually a year before your health insurance or plan begin its pay. When you have an out of pocket, you have to, when you will reach the out of pocket, the 100% is covered. Okay. The premium that must be paid every month to enforce the policy. Covered services that are intended to prevent disease or intermittent disease while it's more easily, example for preventive care service including screening. This is free. Qualify events. Any event defined by the Internal Revenue Service that allow individual to change their benefit section. Example of event may include a marriage, birth, child, or move. The time that must pass before coverage can become effective for an employer or dependent who is otherwise eligible for coverage under an employer health insurance plan. That is for I'm done for this. Yeah. If somebody have question or things, yeah.
No apparent question at the moment.
Sophie Bhai, I have one. So if you can explain if is a job loss a qualifying event, and how does one go about getting insurance if they don't want to go through COBRA in the event of a job loss?
Yes, the job loss is a qualifying event.
So Kamakal, if people want to know further about it, they want to do some more research on this topic, where should they go? What can you recommend few?
Yeah, they can contact me by phone, email, or text. Then I can help him to guide what their best option for that.
Okay.
Are there any websites that they can look at prior to calling you beyond what you shared with us today?
Yeah, you can go to the marketplace. Anybody can go to the marketplace and fill up the application. And also they can have explore things. If you like, I can also, you can just text me or email me. I can also share my portal link so they can explore by themselves what option they have available.
Can we please ask the moderator or the support to show his business card that we had in the beginning? And I apologize, just so that everybody has your contact information.
I believe it is showing up.
Oh, okay.
Yeah, everybody seeing this, my contact information?
Yes, we are able to see. Kamarkal, are there any other general questions that you get, some general inquiries that you get? What is the most common question that you get about when you get these healthcare inquiries?
Yeah, the most common question, what is my premium? So the premium is the same for everybody if you buy the insurance through marketplace or private or anywhere else. But the difference is here, if you go through marketplace and you will be qualified for premium tax credit, your premium will be lower. I can share you one thing. There is an example of if someone have like the plan, okay, is an individual. Here his income is between 100 and 150% of the federal poverty line. Okay, this make about 12,760 to 19,140. If the plan have a maximum out of pocket 8,550, they will reduce to 2,850 on top of the premium tax credit. Like if this plan have $1,000 premium, so their share is only 10%, they are paying $100. But their out of pocket also will be reduced to 2,850. If somebody have a family of 3, and there is income is between this 21,720 and 32,580, their maximum out of family coverage standard is 17,100. So that will be reduced to 5,700. If your income is going up, like if income is 200 to 250% of federal poverty limits, so and the income will be 25,000 to 31,000, so this 8,500 go down to 6,800. And also the same way reduce the co-payment, deductible and everything, by that it go down for a standard plan.
Okay. So on the same note, let's assume that if I fall into the second one, right in the middle, with the income range for a family of 3, let's assume that if I make $40,000 a year, so that will be the plan for me, right?
No, this is the plan. This is just the example. Like some plan have a 17,000, then it is going to 5,700. But if your income go below that one, so this can go up to 1,000 also. It can go further down.
Of course, but if my income is $40,000,
yes,
then that means my family out-of-pocket expenses are 5,700.
Yeah, 5,700. Yes.
So let's say if for whatever reason I had to go.
Yeah, but this is also some insurance company, because this is the competitive market. So some insurance company give you more lower out of pocket. This is just the example for a medium.
One example, of course.
Yeah, but some companies offer you more discount, and this is they cannot charge you more than that, but they can charge less.
And how would you, and then I'm going back to your original question that you mentioned that you get the most, because now I'm looking at it and I'm thinking that if I, let's say if I fall into one of these, what my premium would be. How would I know what my premium is then?
The premium is based on the age, and basically the health insurance is all premium is based on the age. Okay.
Okay.
If somebody is 20-year-old, all 20-year-olds have the same premium for same plan.
Okay.
If somebody is 30 years old, all 30 years have the same premium. But the premium tax credit will be different on the basis of their income and family size. So like somebody getting 90% discount, somebody getting 97% discount, some people getting 50% discount, some people getting 20% discount. It depends on, because the maximum is up to 400% of the family poverty limit of a person. Like if somebody have, this is 12,760 is for one person. If you multiply by 4, if they are more than that, they are out. They will not getting any premium tax credit, and they are not allowed to buy the policy through marketplace. They have to buy off exchange. They have to pay the full premium and full deductible and out of pocket. If their income is more than 400% of the federal poverty limit, depend on their family size.
Okay. Kambar just mentioned that he has a question, but since we are continuing this, I just have one more question for the same topic. What if, you mentioned that obviously age factor would be a reason that your premium will be low or high. What about a pre-existing condition then?
Now there is no pre-existing condition. Whatever it is, they must have to give the insurance. They are not allowed to ask you what's your condition. They are prohibited to ask you what your medical condition.
Okay, so you're saying that my pre-existing condition will not be a factor to determine my premium?
Yes, correct.
Okay, thank you. Okay, Kambar, I'm sorry, you have a question?
Yeah, I had a question. So if someone has health insurance through their job, let's say for the first half of the year, from January through June, and then they lose their job, then they get insurance through the exchange, how is their tax credit calculated?
Yeah, tax credit calculated on the total annual income when you file your taxes. It is disregard, it is for 6 months, 9 months, or 12 months. The PTC will be calculated on the whole year of income. You get 6-month credit, but they will calculate for how much you qualified for a 12-month.
So it's calculated yearly, but applied monthly.
Yes, it's yearly at the time of filing your taxes.
Okay, thank you.
Uncle, I have a question. Are there different rules or guidelines if I'm a citizen versus green card holder versus undocumented?
Undocumented is not allowed, but if you have any legal residence like a SLM, immigrant, work permit, citizen, everybody is eligible for that. You must be a legal resident of the United States.
One more follow-up question. Is filing taxes required to be able to qualify for the insurance? Say if I do not file my taxes for a year or two, do I still qualify?
Yeah, then you will receive the bill from the IRS.
Okay.
But the PTC you will get, you must have to be file your taxes. And there is one other thing I also mentioned. If you are married, you must file joint tax return. If somebody is married, not filing joint return, they are not qualified. They have, if they have a PTC taken, they have to pay back all the credit if they are not filing jointly.
Well, one last follow-up question. Say I'm a green card holder and I just moved to America within 6 months. Do I still qualify for insurance?
Yes.
So there's no restrictions on how long you've been in America?
No. You will be just like you're getting today immigration status, you can apply tomorrow.
Thank you.
Deadlines or any certain days that we must acquire the insurance, for instance, because I have health insurance today through my work. And I know every November we must renew it. We must accept the terms, and if you don't, basically you don't get insurance. Is there any? How does the private marketplace work? Can I just go to the marketplace and get it any time of the year?
No, there is This is called open enrollment period from November 1st to December 15th. Anybody can apply and the coverage will start from January 1st. Okay, if somebody lose coverage in between the year, in January, February, whatever it is, so they are eligible to apply through marketplace. They are lose their coverage, like they have a job, they lose their job. This is qualifying event. They have a add in a family member, they got married and they move to other state. So because it depend on the other states and other zip code. So if your move is qualified, so you can get a coverage, but you must be before you are also will be covered before 60 days. Like if you don't have from January to June, you don't have a coverage and you want to apply in July, no, you can't get it. But if you lose coverage in February, so within 60 days, you can get new coverage. Or you can you get a notice. Okay, my job is going to end by the end of the month. Okay, you get a letter. Okay, your insurance will be ended. You can apply before ending the coverage, then your coverage will be start the first of the next month, right away. It means there is no gap.
I think with that, we have no more questions. Again, on behalf of IEC Husseini and the community, I would like to say thank you to Khamar Uncle for donating his time today. We definitely did cover a lot. There are probably a lot of questions for anybody that's watching online and at home that can't reach us directly. Khamar Uncle's contact information is up. Everybody, please call him directly. He's more than willing to help.
Because this is an educational thing. I cannot share my thing, but somebody will text me. I can share my website. They can go there and they can explore what the plan, what options they have, how much premium tax credit they will get, how much CSR they will get. They can do everything.
And as we stated earlier, deadlines are approaching. The new year is about to start in a few weeks. There's not too many days left for you to sign up, especially if you have elderly parents. There are a lot of families in our community that have elderly parents living with them. They can definitely benefit from the services. They all are, due insurance. They should have it, especially with the current COVID environment. And with that, I'd like to end our program. Everybody, thank you, and Khuda Hafiz.
There is one more thing I want to add, because this is somehow is in hurry that we will do. Try to do our best, but it's a very short time and things, and we're doing first time. There is also old people in our community. There is a Medicare also have same type of open enrollment period. They can change their plan. They can see, because Medicare is also very complicated, and there is open enrollment ends on December 7th. So there are only few days left. So if somebody wants their parents to have or just want to review what the coverage they have a best coverage or they have other alternate, so I can be available for them to discuss what they have. I can review things, what is they have it, if there is other better things available, because Medicare is also going to be very expensive, because the Medicare is paying only 80%, 20% you are responsible. But some other plans available, they will cover their 20% without paying any premium.
Thank you, everybody. Khuda Hafiz, and inshallah, you guys stay safe during this